Peaks of Health Metabolic Medical Center's seminar this month addresses women's sexual health and two procedures they believe are very important. And Dr. Tracy Lenhart is back to discuss these further. Welcome back. How are you?
Thank you. It's good to be back.
So we're chatting seminars today and specifically what you're talking about this month, but kind of overall, why as a medical director do you want to do these seminars so often? Because I know you feel that they're very important.
Well, I teach all the time. I'm either lecturing somewhere or I'm teaching medical students or residents at the hospital. So why not teach the public? So this is our opportunity to let the public know what is available to them, why, so we do things on thyroid and hormones, and this one actually is a big topic a lot of women don't want to talk about.
Well, you're making it easier to talk about because you're including wine and chocolate in this one,
Exactly.
Right?
Yeah, it's called Sex, Wine, and Chocolate.
I love
And there is wine and chocolate there, by the way.
Deal. And of course, you're going to be educated on some of the procedures. So talk about how you can help people when it comes to sexual health.
Well, it's amazing some of the things we can do. Obviously, optimizing the hormone replacement is key to be able to have sexual drive. But then there's some other issues. Some women have chronic infections. Some women have, they're dry, and in other women, actually, it's uncomfortable anymore. So we can use a vaginal laser. It's called a Mona Lisa vaginal laser, and we can rebuild all that collagen in that skin inside. And so everything lubricates, everything starts working better. And then we also have something called the O shot. Well, you can figure out what it means. And that's where we use PRP therapy, platelet-rich plasma, and we draw your blood out, we get your growth factors, and we inject it back in. So things like urinary leakage, both the laser and the O shot work for urinary leakage, and combined they work even better because they're rebuilding that tissue that loosened up down there.
You know what? It's interesting to think about those two procedures because they're not something that people typically talk about. And I like that you're doing a seminar, though, because there's so many education things, and the things you were just rattling off there, I would have no idea would be helped by those procedures.
Oh, yeah. I mean, we have women with chronic cystitis. We have women with chronic bacterial vaginosis. These things, they're game changers for these women. Women with painful intercourse, again, it relaxes the musculature, and it can be a total change. Women with breast cancer who can't take hormones, you can actually use the vaginal laser on them to, again, help relubricate everything, but also helps stimulate that tissue.
Obviously, someone who's been practicing, and with your experience, you've done a lot of these procedures. What's the feedback like with both of them? The
feedback is amazing. It is a total game changer, especially the vaginal laser for these women who've been suffering for a long time. It is a complete life change, but again, if their lifestyle, they, are having trouble achieving orgasm, or they're having, trouble with lubrication, it really helps. If they're having urinary leakage, that's a big, huge one. I mean, I have so many of my women postmenopausal that are complaining that they're leaking, and that's really embarrassing to them.
Yeah.
And when you can change that for them, that is, again, lifestyle changing for them.
And most of it just seems education, which I mean, I'm all ready just to think of those different topics put together. I'm curious, Tracy, when you do talk about these in seminars, what do you hear about? People hesitant to maybe come in, but then happy that they made the phone call and scheduled the procedure?
Yeah, I think most people are kind of, worried, or they're going to hurt, or what's going to happen. They're virtually painless. There's very little, pain involved, afterwards.
I was going to say, now I'm surprised to hear that. I'm glad you're addressing that.
Yeah, well, we use topical and numbing medicine.
Okay.
So, the procedure itself, afterwards, especially with the laser, you may feel a little bit of like a sunburn for maybe 12 hours, and that's it, and you're done. So, I mean, there's very little downtime with this. And for them, after the procedures, what we hear is, oh my God, I wish I did this years earlier. And the seminars I like because it's a nice, relaxed atmosphere. It gives them an opportunity to actually ask their questions.
And I'm glad it gets people to get to know you. You're so easy to talk to, and I appreciate your time so very much. And if you're interested or you have questions for Dr. Tracy Lenhart, well, of course, get in touch. There's a special offer. And then don't forget that seminar that we already touched on. In fact, it's going to happen on Tuesday, July 30th. For all of the information, just visit the website that you see right there on your screen.